The study that I will be presenting to you today in the next 20 minutes or so is called Evidence for Better Lives, a global cohort study to tackle violence against children. In contrast to the other studies that we've just heard about, what I will be talking about is aspirational rather than presenting existing research. So I will be trying to give you an overview of what we want to achieve with this study, what it's based on, and how we're trying to learn and benefit from the experience and wisdom of the studies that you've just heard about. The basic origin of this study is related to the problem of violence against children. There are different estimates about levels of violence against children across the world. One is the one that is adopted by the World Health Organization that estimates that around 1 billion children across the world have been affected by violence in their life course. And there are about 1.6 billion children in the world. Here are just a few more specific indicators. About 1 in 5 children are subject to severe forms of physical punishment. About 1 in 3 children experience bullying in school. About 120 million girls under the age of 20 have experienced forced sexual intercourse. And about 1/5 of all homicide victims globally are children and adolescents under the age of 20. In this list, I've put in an attitudinal measure, which I find quite astonishing and important. About half of all adolescents believe that a husband is justified in beating his wife. I show this figure to you because I believe that there is an important link between the topic of violence against women and violence against children. Now, a few years ago, more precisely in 2015, the global community adopted the Sustainable Development Goals. And one of the important things that happened with the Sustainable Development Goals is that for the first time in human history, there are goals at a global level that aim at addressing and reducing child abuse, exploitation, and different types of violence, and to promote children's mental health and well-being. Within the Sustainable Development Goals, those of you who are familiar with this kind of discourse, this can be found, for example, in Goal 16, which is about reducing violence, or in Goal 5, which is about gender equality. Now, these are extremely important goals, but the question is, how do we actually achieve them? What can we do to, if not eliminate violence against children, which is not going to happen in the next 15 years, at least to reduce violence against children? And I think there are at least 3 big problems in my thinking that I would like to briefly point out. An ambition gap, a spatial gap, and a developmental gap. What do I mean by the ambition gap? We have lots of ambitions formulating the idea that we should reduce violence against children. And I just flag up a few important publications that have been produced over the last few years. Now, of course, all these statements are slogans, they're aspirations, but the big problem is, what do we actually know about what needs to be done? Now, we know increasingly what kinds of programs have desirable effects in trials, and increasingly in criminology and in public health, randomized controlled trials have been conducted. We are beginning to learn how to scale them up, and we are beginning to have relevant evidence in low and middle income countries. But the Sustainable Development Goals expect something completely different. They expect us to achieve population-level sustained declines in violence. And that's something else than achieving an effect in a randomized controlled trial. We know close to nothing about how to achieve population-level change, and we know very little about the kinds of system changes that support macro-level declines in violence. We have a spatial gap. This is a map of the world where the size of the country is proportional to the number of homicides in the given country. And you can easily see that Latin America and Africa come out very big. Now, the next slide that I show you shows you the world by research output. And you can see that Europe and the United States come out very big. And what this suggests is that the knowledge that we would need to effectively address violence against children is not where the problem lies. Now, the third problem that I want to point out is what I call the developmental gap. And I try to illustrate this with the Singapore-Caracas problem. And you might have a different terminology. I'm not sure whether I succeed in giving you an idea of what I mean by this problem. Singapore and Caracas have roughly the same population, about 5 million people. Now, Singapore has about 10 murder cases per year, and Caracas has about 3,500 murder cases per year. So they have huge differences. These huge differences, by the way, are relatively recent. The two cities in the 1920s, if we can trust the data, had roughly the same homicide rate. So it's something that has emerged over the last 100 years. Now, the problem is, if we think about this developmentally, we've seen a number of longitudinal studies. The question is, at what age, if we can observe a cohort of children born in these two cities, at what age do the relevant causal mechanisms generate these huge differences that we observe, let's say, between ages 18 and 20? What are the active ingredients of the low homicide rate in Singapore? Is this early child development? Is it the first 1,000 days that actually play an important role? Or is it something happening during later childhood, during primary school? Or is it something happening during adolescence? For example, linked to gangs, or for example, linked to drug trafficking. At this moment, nobody really has an answer. But it's easy to see that if we want to address the high levels of violence in Caracas, it would be important to understand at what age the active ingredients are put into the developmental process so that we can design the right kind of intervention strategies. So I'm not going to go through these slides because of time limits, but I want to go directly into evidence for better lives and what we want to achieve. Evidence for Better Lives is not just a research project. From the beginning, we tried to combine three elements. Research on child development with a cross-cultural birth cohort study, a policy impact component where we want to work with municipalities across the world to actually change policies and practices that are relevant for reducing violence against children. And from the beginning, we want to integrate a capacity building strategy, in that we believe that it's important in these kind of studies to advance and enhance the capacity to address problems in the countries where we are doing the research. We've gone through a number of stages in developing this study, and I just want to show this very briefly. The project started about 3 years ago with a scoping event, a workshop, an expert workshop. Then over 1 year, we have conducted a feasibility study where we try to figure out who we will be working with and to create a consortium of participants and identify the sites where the study would be conducted. And in 3 weeks' time, on the 1st of June, we will be starting with what we call the foundational study, where we will put to a test all the elements of the study over a 2-year period to learn whether we can conduct the first ever, we believe, the first ever birth cohort study on this kind of topic in 8 different places across the world, and including a policy and a capacity building component. What are the main components, active ingredients of this study? We have 8 study sites in all major cultures of the world. We focus on medium-sized cities. We're not going to do research in rural areas, and we're not going to do research in very large cities. The sample will consist of 1,500 children and their families in each site. We currently have a very ambitious data collection schedule program. We want to start in the last trimester of pregnancy with data collections at ages 6 months, 18 months, and 30 months. But the study will be designed from the onset to allow us for a long-term continuation of the study. Whether the funding will ever come in, we don't know. And all the longitudinal studies that I know of, and we have some representatives who have been able to run longitudinal studies over several generations, and they have a lifelong history of being able to raise the funding and make this happen, like David Farrington. But everybody knows that this is something that you just need to try to do at the very beginning, and then you will see whether this actually happens and whether you're successful. We have an important ambition in terms of including fathers and mothers as respondents. Most longitudinal studies, when they collect data on parents, focus on the mothers, and at least we want to make a big effort to include fathers, or the male people who are present as the child grows up, because they have been neglected in many studies, and we think, especially when it comes to cross-cultural comparison, it's important to include them. I am a criminologist, but I don't expect these children, at least in the first few years, to become highly criminal. The topic of criminology, of course, comes into play because we're interested in violent victimization, both proximal victimization, but also vicarious victimization through exposure, for instance, to violent neighborhoods that may affect the mother and the children. The sites, very briefly, include Kingston, the capital of Jamaica, Koforidua, which is about 80 kilometers north of Accra in Ghana, Stellenbosch, which is about 20 kilometers north of Cape Town, Cluj-Napoca in Romania, Ragama, which is north of Colombo in Sri Lanka, Talakalam, which is a satellite city of Islamabad, Hue, which is in the middle of Vietnam, and Valenzuela, which is part of Greater Manila, but an independent city within the Greater Manila area. Important to understand here, these sites differ vastly in terms of levels of violence, between Stellenbosch and Kingston, for instance, being very, very high on levels of homicide, but they also differ vastly, for instance, in gender inequality. They differ vastly in terms of income inequality, between Romania being relatively equal, more equal than many Western European societies in terms of in terms of income inequality, to South Africa, which is hugely unequal in terms of. So we have a large variety of cultural characteristics, economic characteristics, and social characteristics. Here is the consortium that was in Cambridge. Unfortunately, they can't be here today. The consortium consisting of a large number of people. I just want to show you some of the members of the consortium. They're all trying to capture the project in one-hand movement. Here is Joseph Osafo from the University of Ghana. This is Yen, a junior medical doctor at the University of Hue. This is Adriana Baban talking to Tang Pho from Vietnam. And this is, for instance, Siham Sikander, a pediatrician at the university in Islamabad. What this shows you is that in our thinking, we are trying to work with excellent academics in the different sites. And it's not a project that is owned or controlled by Cambridge. It's a project that we strongly believe needs to be jointly developed by the participants of this study. I just want to show a few things about how we are trying to work towards making this project work. We've gone through quite a process of developing an organizational structure, and everybody who has run a longitudinal study, especially a multi-site longitudinal study, knows that developing an organizational structure that can make this function over a long period of time is going to be very demanding. And one of the things that we do is that we have bi-weekly meetings among all the partners using Zoom and bringing everybody together and involving everybody in the development of the study. We are currently working on strengthening our research profile by doing a number of things. We are currently, for instance, adding an element of collecting biological data, and not just collecting them, but also analyzing the data. And the focus here is on measuring inflammatory markers of maternal exposure to stress. So in the first two ways of the data collection, which will comprise pregnancy and another measurement at age 6 months of the child, one of our primary interests is to better understand the intergenerational effects of intimate partner violence during pregnancy on child development in the first few months. In these study sites, there are some sites where we know from some studies that strong proportions of mothers have been exposed to intimate partner violence during pregnancy. In Pakistan, for instance, the estimate coming out of the Demographic and Health Survey, which is a very large population-based survey of the overall population with a subsample of 4,000 mothers that report in this study, about 25% of the mothers have experienced intimate partner violence during pregnancy. So we want to better understand how this works, and the first publication that we just submitted reviews the current evidence on what is known about mediating pathways and what this means for prevention science. In November this year, we are going to launch what we call a policy summit in Manila. Now, what we are trying to do here is to build this community involvement that we heard about is so important to maintain this study and also to have, an engagement of policymakers with the study. So what we were able to do is to raise the money to bring the mayors from each of the cities together in Manila and to talk with them, to involve them in thinking about what can be done about addressing violence against children. And we do this, amongst others, by starting to call these cities Pathfinder cities. And the idea here is to give the mayors, the participants, very similar to the Bradford study, a sense that they are part of a special thing where something positive, helpful for the families might be happening. We do this, by the way, in collaboration with WHO and UNICEF and trying to involve them in the policy change process. We also have started to initiate capacity building. For example, fieldwork training is a very important component of such a big study. You need to train the field workers well to do comparable work. Now, the field workers will be supervised, I'm sure this happens in all your studies, by junior academics. And so we thought that training these junior academics in how to do this well and actually actively involving them in developing the training materials is something that helps to build capacity of doing these kinds of studies well in the different sites. And so that's so both Diana Taut and Margaret Marlowe are junior academics, and we want them to take a major role. In terms of capacity building, I have to say that this event here, I don't know whether I've told this to the participants. This event here is part of the capacity building strategy because we are hoping that the videos that we have produced will be used in the different sites who can't be present here, but who would like to understand what you've been doing, how you've gone about doing your longitudinal studies. And so we want to share this knowledge and involve again the sites into promoting, into learning how to do these studies. I want to conclude here just what our ambitions are. We would like to become kind of like, if possible, this first, the first attempt of a global birth cohort study on psychosocial health in low and middle income countries. We would like to become an important resource for interdisciplinary developmental work on child well-being in the early 21st century. And so we try to set this up with very big ambitions. We want to integrate a policy impact strategy. We collaborate with international organizations, but also with the city authorities, because we think involvement of local authorities is absolutely essential if we want to move towards realizing this sustainable development goals. And we want to include a capacity building approach from the beginning and promote young scholars, promote South-South collaboration and translational science to contribute to a step change in the capacity to promote child well-being. Thank you very much.